Hello, my name is Michelle Hobb, and I'm excited to share with you some strategies to enhance communicating with those with dementia or Alzheimer's. My background is as a speech language pathologist, and that's where my passion for making sure that we try our very best to open the lines of communication and meet those individuals with dementia or Alzheimer's where they are. So, first, I'd like to start with just a brief overview. As you heard Heather Sloan, she talked about what dementia is. So you can refer back to her presentation if you have more questions or for a brief review. But basically, what I'd like to share today is that I want you to think about dementia as being the way that the brain processes the world is differently than for those individuals without a brain disorder. So we need to think about how the brain sees, hears, processes touch and smell and taste. These things are all related to how individuals interpret the world, but it also relates to how individuals express themselves to the world. So this slide just demonstrates all of the different areas and behaviors that an individual with dementia or Alzheimer's may experience. The primary reason that I wanted to begin working at Meadowlark is their philosophy of person-centered care. I know we all think that we understand that, but in reality, once we get into the thick of dealing with the behaviors or the daily stresses of trying to get to meetings or appointments or having meals taken care of, medications taken care of, what happens is that we become overwhelmed. And I think it's just important for us to try to find that space where we can pause and focus on considering what the needs, not just the medical or the physical needs, are for our loved one, but rather looking at that individual as the person that they've always been and the person that you've always known. That requires us to think about the behaviors that we often see in an individual with dementia as a desire for communication. So, if we think about that for a second, if we are seeing strange or unusual behaviors from our loved one, what that can help us to do is to pause and evaluate the situation and the behaviors and recognize that those are likely caused by a desire to communicate. Looking at what is it that the psychological needs are for our loved one. Are they being met? Does our loved one feel the love and the comfort? Um, Obviously, their occupation and identity have changed since the disease has progressed. But what can we as care partners do to help them feel that attachment and that inclusion and that sense of who they've always been? Once we recognize that these behaviors are brought on by the way that the individual interprets the world, then we are able to take that next step. So, now what is that? What do we do to help our loved one deal with the changes they're experiencing? Well, let's start with the basics. Check the environment to make sure that you're optimizing your interactions with the minimal distractions. So, do they have their glasses? Can they see? Look at the sound. Are they wearing their hearing aid? Is there a lot of external noise? Are there competing sounds that are making it difficult to focus on your voice? Are they too hot or too cold? What's their comfort level? If we're uncomfortable or any of these other things are not quite right, it makes our ability to understand the world more difficult. Communication strategies. The number one thing I want you to think about is engage. Keep that word in your mind at all times. Sitting face to face and making eye contact may seem like a simple thing, but it's often the most overlooked. When we get stressed and overwhelmed with our current environment, this is often the thing that's the most challenging to do. Using short sentences is really important. Tell the individual what to do. Try to avoid telling them what not to do, as often the individual will only follow and understand the last couple of words. Using a gentle and audible voice with positive uplift helps the loved one feel that connection with you. Facial expressions help to show compassion and patience, and although your loved one may not always understand what you say, they will definitely see the love and the joy in your face as you communicate. Using pictures or gestures and writing is very valuable in helping to express what it is that you want to communicate with your loved one. Reading is one of the last skills that an individual will maintain with dementia. So don't be afraid to write and use pictures to help an individual follow routines or complete tasks. Continuing with communication strategies, validate your loved one. Be with your loved one. What this means is that we want to acknowledge and accept his or her feelings. A great example of how to do that would be, "You look concerned, Mary. What about that sound makes you feel worried?" What we're doing is recognizing that we see this individual in the state that they are, and then that we process that there is something in the environment that they could be interpreting differently. Another example is to be in his or her current space. Where this example comes from is that oftentimes individuals don't live in the moment. They may be living in the past. So we want to validate this by saying something like, "It's really late. Let's write your mom a letter and tell her what you are feeling," rather than trying to explain to them that their mother has passed away and it doesn't do any good to try to tell the mother what it is they're feeling. Continuing on with communication strategies, giving more time than you think you need to for your loved one to respond. This can often be really challenging. And again, when we're in the thick of trying to get to appointments or get tasks done, it's really hard to pause and to allow your loved one time to respond to what it is you're asking or telling them. Notice what your loved one is engaged in and then try to join them where they are. If you're feeling overwhelmed, pause 10 seconds before responding. I know this 10 seconds may seem really short, but again, when you're in the thick of things, that 10 seconds can feel like an eternity, but it can also give you the time to process what's happening and then react and respond. One of the things that's tricky is when individuals try to communicate with new people. And I think it's important for us to maintain those relationships with others, but provide the support for our loved one so that they don't feel at a disadvantage right away when that loved one tries to interact with a friend. So, setting the scene for your loved one can make that all the difference in the world for that. The example I give here is, "Look, John from church came to see you on this cold winter day. So, what that's doing is providing a successful opportunity for your loved one by recognizing who the individual is that came to visit, how your loved one knows that individual, and it also sets the scene for orientation as to a cold winter day. So, to wrap up our communication strategies, use specific language. Ask simple questions, provide simple instructions, and use visuals and gestures whenever possible. And provide one direction at a time to optimize the ability to understand. As a speech language pathologist, I would be remiss to not talk about how therapy can be beneficial in the dementia process. Speech and occupational therapy, in particular, can help to provide one on one assessment of the strengths and weaknesses of the individual with dementia, but also within that environment. It helps to look at and create personalized options to compensate for those challenges and to build strategies around those strengths. As the disease process changes, education and modifications to the current plans can be done. One of the most valuable things that I think therapy can do is to help to create aids to increase independence and improve the overall quality of life for the individual with dementia as well as the entire family. As we look at the care partner, therapy can allow the environment to be changed, situations to be altered to help the care partner be a family member, not just be the care provider, but maintain that relationship of being the spouse or the sibling or the child of the individual with dementia. So if you're interested in this, you can simply talk to your physician about having a speech and or occupational therapy evaluation to help look at the ways that they can benefit you and the individual with dementia. In conclusion, I just would like to provide a little reinforcement. I hope that you will take the information you learned in this section and move forward with it. It's not intended to make you feel badly about ways that you may or may not have communicated in the past. We all do our best in the moment with what we know and what we have. So please just try to move forward and look at this as an opportunity for growth. Keep in mind that your loved one is still here. He or she may be changing daily, but the person that you know and love is still in there. They may just look a little bit different or may react just a little bit different. Help your loved one find a sense of accomplishment. Everyone feels better and needed when they do things for others. So finding those little things that can help your loved one feel like they're helping you, like they used to help you. Again, recognizing that you're not perfect. No one expects you to be. Accept the challenges that you see and you face on a daily basis and learn from them. Providing that care day in and day out can be very draining. It's important to stay connected with your family and friends. Also, reach out for help. Incorporate the outside supports, utilizing services like home health or companions, support groups, and individual or couples counseling. These are resources that are created to help you maintain that relationship with your loved one. There's not a sign of weakness by reaching out. Be You can pay special attention to Bridget's section in the coming weeks or days when you choose to listen to these, and she will provide additional reinforcements to how you can get support for yourself. So ultimately, I just encourage you to keep your heart in your communication. Thank you very much for this time, and I hope that you learned something new and that you can maintain that love within your communication strategies and techniques.